Hello, I'm Candace Holloway, and I will be presenting Implementing BMI Screenings in Obesity Management in Antepartum Patients at a Community Health Center. My community members include Dr. Ashton Lindsay, Dr. Maria Snell, and Dr. Eureka Samuel. Let's begin with the background of the issue. Maternal mortality is a growing problem in healthcare globally. In 2020, the World Health Organization reported that more than over 200,000 women experienced maternal death during or after childbirth. In 2009, the Institute of Medicine published recommendations for weight gain during pregnancy. Based on those guidelines in 2021, the United States Preventive Service Task Force recommended screening prenatal patients for obesity as well as implementing behavior interventions to decrease the risk of excessive weight gain. The recommended screening tool for the assessment of antepartum patients is the body mass index measurement, or commonly known BMI. This measure has been supported by the Agency for Healthcare Research and Quality, the United States Preventive Service Task Force, the Institute of Medicine, and the American College of Gynecologists. Screening weight management during pregnancy are important because over half of United States pregnant women are overweight or obese, with 8% of the reproductive age obesity women with associated pregnancy complications which caused extended hospital days. This project is significant because a federally qualified health center located in the southern portion of the United States identified a deficit in BMI screenings of their antepartum patients, limiting their ability to identify the risk for obesity and excessive gestational weight gain despite the current recommendations. The purpose of the scholarly project was to analyze the effect of screening and interventions on antepartum obesity. There were three specific aims for this project: to improve the health of antepartum patients, to improve antepartum patients' pregnancy outcomes, and promote provider collaborations. When conducting my literature review, I focused on five areas: gestational weight gain, adverse outcomes, BMI screenings, early identification, and nutritional counseling. Excessive gestational weight gain is associated with severe maternal and fetal risk. These risks include pregnancy-induced hypertension, gestational diabetes, and preterm or cesarean delivery. Most patients are unaware of the long-term consequences of excessive weight gain. Some adverse outcomes such as hypertension and diabetes can linger long past the postpartum period and become chronic conditions. Psychological factors such as family perceptions, emotional suppression, depression, and unhealthy dietary practices may predict excess gestational weight gain. Socioeconomic factors cannot be left out as a predictor of excessive gestational weight gain. Women in socially vulnerable populations have limited access to healthy food and may suffer from food insecurity. It is known that low-income areas commonly have easier access to cheaper, unhealthy foods such as fast food restaurants and convenience stores, which increase the risk of poor dietary intake and lower compliance with recommended weight gain. Complications during pregnancy not only have direct consequences for the mother and baby, but they also can be predictor of future chronic illness risks. Two of the most significant adverse outcomes during pregnancy associated with excessive gestational weight gain are gestational diabetes and hypertension in pregnancy. Worldwide, hypertension diseases complicate 10% of all pregnancies. Preeclampsia and hypertension in pregnancy, both are detected after 20 weeks, cause significant morbidity and long-term cardiovascular impairment in pregnant women and their kids. Hypertension in pregnancy accounts for 14% of all maternal fatalities. According to studies, weight control in gestational diabetes patients is crucial since it can lead to preterm birth, cesarean delivery due to larger newborns, and a long-term diabetes diagnosis. Macrosoma is one of the most prevalent problems in diabetic pregnancies. Infants with mercosoma are more likely to develop metabolic disorders such as obesity, hypertension, and type 2 diabetes later in life, perpetuating a cycle of poor health and chronic disease. Another common adverse outcome of excessive gestational weight gain occurs after delivery. Postpartum depression has had the highest incidence of psychological conditions in women after pregnancy. And a common factor in depression is obesity. When we think about BMI screenings, we must consider that maternal pre-pregnancy BMI can modify the associated health risk of inadequate or excessive weight gain. During antepartum care, BMI screenings can increase the surveillance of women's weight and behavior during pregnancy. By implementing BMI screenings, the provider is able to educate and counsel patients on health risks associated with obesity in pregnancy. During those routine visits, women with elevated BMI scores should be encouraged to lose weight before pregnancy to mitigate maternal health risk. The benefit of early identification is that it allows women to take an active role in their care and begin lifestyle modifications that can change the trajectory of their health and their unborn child. Early identification is critical and the optimal method to diagnose maternal risk. Some risks could be life-threatening to both the mother and the fetus. Studies continue to prove that higher pre-pregnancy BMIs are more likely to exceed gestational weight gain recommendations. Gestational weight gain has become a significant predictor and contributor to adverse maternal and neonatal health outcomes. This knowledge can assist providers in initiating interventions to combat excessive weight gain earlier in the pregnancy. Once we have identified the risk, we must implement nutrition counseling to mitigate excessive gestational weight gain. A healthy food pattern during pregnancy improves fetal growth and development. It has been linked to a decreased risk of pregnancy problems, whereas unfavorable dietary patterns, undernutrition, and overnutrition have been linked to poor pregnancy outcomes. As a result, it is critical to analyze and monitor maternal nutrition before and during pregnancy and to make changes to optimize maternal nutrition as needed. Maternal nutrition status is a modifiable factor in maternal weight management, which makes medical nutrition therapy essential. It can teach antepartum women to modify their dietary intake while promoting appropriate weight gain. For my theoretical framework, I utilized the Iowa model of evidence-based practice, which was introduced to promote quality care. It was developed for the evaluation and implementation of research evidence in patient care. It consists of 7 steps to consider the evidence and determine if clinical practice changes are indicated. As I navigated through the 7 steps, implementing the steps allowed me to identify an opportunity for improvement by utilizing BMI screenings to identify patients with an increased risk of excessive weight gain. I established a purpose, formed a team, gathered evidence, designed a practice change, developed a protocol, analyzed the results of the change, and then disseminated those results. The method I used was a quantitative retrospective design. Participants were not engaged in this project. By utilizing a retrospective chart review, the electronic health records from the clinic were used for data collection as previously approved. Quantitative research is used to collect and analyze numerical data to make predictions and generalize research for a wider population. This type of research allowed me to answer my question by manipulating independent variables to measure its effect on a dependent variable. For my sample, descriptive statistics was utilized to evaluate the demographic information of pre and post BMI screenings. The pre-screening sample size consists of 100% females. The post-screening samples also consist of 100% females. The ethnic background of the sample of the pre-screening included 43% African American, 3% Caucasian, and 64% Hispanic. The ethnic background for the post-screenings had 14% African American, 0% Caucasian, and 86% Hispanic. The data collected to evaluate the screenings for pre and post BMI during antepartum care visits and referral for nutritional counseling were analyzed using an independent sample t-test statistical analysis. This statistical test used an effect size of 0.05. A one-tail test significance was to observe the pre and post-intervention changes. I chose an independent t-test because it answered questions about comparison of the means of precisely two groups. It is often used to determine if two population means are different. Here are two histograms that show the delta BMI on both the pre-intervention and the post-intervention. Unfortunately, there was no statistical significance to show a change in BMI was less after the intervention. Pre and post BMI values were compared. On average, the pre-BMI value was less than the post-BMI. An independent sample t-test indicated this difference and proved that it was not statistically significant. There were some limitations to the study. The initial prenatal appointments of certain patients took place during the second or third trimester, and they were deemed late to care. According to the Institute of Medicine, gestational weight growth should be determined by the individual's pre-pregnancy weight. A more precise estimation may have been obtained if the pre-pregnancy weight had not been known during the first trimester prenatal checkup. A second limitation was time constraints related to the project's timeline for reporting the study results. Additional timing may have allowed time for follow-up on gestational weight at delivery and during the postpartum period. Collecting information on this information may have resulted in a more favorable result and finding of statistical significance. The most significant limitation to the implementation of the study was language. Many of the survey participants, specifically 86%, identified as non-English speaking Hispanics. It has shown that subsets of Hispanic patients who lacked proficiency in the English language also had difficulties in reading Spanish, hence resulting in more time for patient education. The findings of this study indicated an improvement in the number of patients screened for antepartum BMI values within a primary care after implementing an educational intervention. The results revealed an overall increase in the number of screenings for gestational weight gain and an increase in the number of referrals placed for nutritional counseling. Additionally, the study findings suggest that the implementation of an educational intervention is associated with the provision of high quality and compassionate treatment, while routine screenings are typically conducted during primary care visits. The implementation of standardized care processes fosters consistency and reduces disparities in healthcare delivery. This study highlighted deficiencies in the implementation of routine screenings that are commonly advocated as a component of standardized healthcare. The initiative serves to strengthen the notion of education has a good impact on preventative screenings, hence providing further support for the existing body of literature. This project makes a valuable contribution to the field of research by exploring the potential of utilizing BMI screenings as a means of managing obesity and preventing adverse pregnancy outcomes in antepartum patients. The project's impact signifies substantial advancements in the implementation of preventative screening quality improvement initiatives within the healthcare system. This research project is important because as a federally qualified healthcare center, we service the uninsured, the underinsured, and the low socioeconomic populations. The project's findings did not indicate a statistically significant correlation between the use of prenatal BMI screenings and the provision of dietary guidance for managing excessive weight gain during pregnancy. However, it did improve the education of the patients as well as improve the collaboration of providers through referrals to the nutritional counseling. Limitations in the study included a higher than anticipated Hispanic study population that led to language barrier and cultural barrier. The data analysis revealed that the post-intervention screenings undertaken were not in line with the project's objectives. The current investigation may have been enhanced by including additional maternal risk variables rather than solely focusing on gestational weight increase. Recommendations for further research includes a wider participant population, extended time frames, additional risk values. The research site plans to continue implementing the quality improvement project to increase the identification of obesity in pregnancy and increase referrals to dietitians for nutritional and exercising counseling. The overall goal of decreasing excessive gestational weight gain, gestational diabetes, preeclampsia, and other poor pregnancy outcomes. I thoroughly enjoyed doing this research project. The journey through the DNP program here at Maryville has broadened my understanding of research as well as the importance of evidence-based care. I am truly grateful to have had this opportunity. Are there any questions? Concludes my presentation. Here are a list of my references. I thank you for your time and your attention.